Congratulations! You've officially entered the second trimester, and there's so much to look forward to. This is the stage where you might discover your baby's sex and feel those very first tiny movements. I hope this video series becomes your trusted companion, guiding you beautifully through every step of your pregnancy. During these weeks, your baby undergoes incredible growth from just 7.5 centimeters long and 30 grams in weight at week 13 to about 23 centimeters and 820 grams by week 26. To give you a fun visual, your baby will grow from the size of a lime to a banana and eventually a full cauliflower. Starting in week 13, your baby's face begins to look more human-like each day. Their ears settle into place, and their eyes now have the very color you'll see at birth. Until now, the head was growing faster than the rest of the body, but from this point forward, the body catches up. The arms lengthen to match the proportions, and your baby might even start sucking their tiny thumb. By this stage, all of your baby's essential organs and systems are fully formed. The umbilical cord is now mature, protected by a slippery, cushion-like substance called Wharton's jelly. This allows the cord to move freely around your baby without getting compressed. If you're expecting a girl, something truly remarkable is happening. Hundreds of thousands of eggs are already forming in her ovaries, meaning your future grandchildren are beginning their story now. Females are born with all the eggs they'll ever have in their lifetime. Your baby's developing digestive system can already taste the flavors of the foods you eat through the amniotic fluid. Their waste system is active too, with urination occurring roughly every 40 minutes. And yes, since babies pee in the womb and drink amniotic fluid, they do swallow their own urine. It may sound odd, but don't worry. Urine is sterile, and your baby is completely safe. A soft, ultra-fine layer of hair, called lanugo, now covers your baby's body, helping them stay warm until enough fat builds up to take over that job. This hair usually sheds before birth. Inside your uterus, your baby has enough space to move freely. By around week 19, you may start to feel these gentle movements like soft bubbles popping or a light swirling sensation. If your placenta is positioned at the front of your uterus, an anterior placenta, it may take a little longer to notice those first kicks since it provides an extra cushion. By week 20, your baby can actually hear sounds, your heartbeat, your stomach rumbling, and even your voice. An ultrasound is typically performed around this time to check that everything is developing as it should. And it's also when your baby's sex can often be revealed. At week 23, billions of brain cells form, controlling vital functions such as breathing and movement. By week 24, connections in the brain develop that allow your baby to sense pain, and they may even respond to your voice or gentle touches on your belly. Meanwhile, your baby's lungs are making big strides. They begin producing surfactant, a vital substance that will later allow the tiny air sacs in the lungs to inflate and help your baby breathe fully after birth. Right now, your baby is still breathing amniotic fluid. But thanks to the surfactant forming in their lungs, they're preparing for that very first breath of air after birth. This surfactant is a lifesaver. It's what gives babies a fighting chance if they're born early. Starting around week 24, a premature baby has a chance of survival outside the womb. However, at this stage, the survival rate is only about 43%, and nearly half of those babies face long-term health challenges. If there's a risk of preterm delivery before week 34, doctors often administer a steroid injection. These steroids accelerate lung development, improving the baby's chances of breathing successfully after birth. But it's not just your baby transforming. Your body is working tirelessly too. Even though your baby still weighs less than a kilo, your blood volume increases significantly to support all the incredible growth happening inside you. Naturally, this leads to weight gain, with women typically adding about 6 kilograms during the second trimester. As your belly grows, your skin stretches rapidly, sometimes faster than it can keep up with. This can cause tiny tears beneath the surface, resulting in stretch marks. While these marks don't disappear completely, they'll gradually fade from pink or purple to a soft silvery white, becoming far less noticeable over time. Another visible change is the dark line that often appears down your abdomen. This happens because hormones released by the placenta increase pigment-producing cells during pregnancy, a completely natural and common occurrence. We'll dive deeper into important do's and don'ts in the next video. But for now, let's focus on how much better you're feeling. The morning sickness, nausea, and vomiting have mostly faded away. Your appetite returns, and you can finally enjoy eating comfortably again. This is often called the golden phase of pregnancy. Uncomfortable symptoms ease up, and instead, you experience more pleasant signs of progress. Your baby continues to grow steadily. You might notice slight swelling in your feet, but for the most part, you feel well and energized. You can eat a variety of foods, travel safely, and move around freely during this time. The second trimester spans from week 13 to week 27. By the end of the first trimester, your baby is only about 5 inches long and weighs 50 grams. By the close of the second trimester, that tiny little being grows to about 14 inches and nearly 1 kilogram. An incredible transformation. Around this stage, a special ultrasound called the level scan is performed. This is a breathtaking milestone. You get to see your baby in remarkable detail. A tiny, perfectly formed miniature human with a beating heart, developing lungs, a growing brain, and those precious little hands and feet wiggling. You can even watch their movements on screen. It's an unforgettable, emotional moment for every parent. By this time, all of your baby's sense organs have developed. They can hear the world outside, and research shows they respond most strongly to their mother's voice. Sometimes even kicking a little more when they hear you speak. This is the perfect time to begin truly connecting with your baby on an emotional level. You are their only bridge to the outside world right now, so talk to them often. Speak softly, lovingly. Every word, every sound you make becomes a part of their experience. The second trimester is all about mindfulness, mindful speaking, mindful listening. Mindful eating. Everything you do now helps shape the positive traits your little champ will carry into life. Up until now, you've likely been seeing your gynecologist once a month. This monthly schedule continues until week 27, and from week 28 onward, your visits become bi-weekly. During this stage, iron and calcium supplements also become a standard part of your routine, helping both you and your baby stay strong. Your diet is more important than ever. Focus on balanced, nourishing meals, more protein for growth, fewer carbohydrates, and plenty of green leafy vegetables, fresh fruits, and fluids to keep you hydrated. Exercise is encouraged too. Gentle routines like yoga and Pilates are safe and beneficial. This is also the perfect time to begin Kegel exercises, which strengthen your pelvic floor muscles and help prevent urinary leakage, something many expectant mothers experience. Back strengthening exercises are equally important. With the growing weight of your belly, your spine is under extra pressure. Avoid high heels as they add to the strain. Opt for comfortable, flat shoes that support your posture. This is also the stage when you'll receive key vaccinations. The first tetanus shot is typically given around 20 weeks, followed by a triple dose at 28 weeks. A flu shot is optional, but highly recommended, as infections during pregnancy can pose additional risks for both you and your baby. If you're expecting your second child, this is a wonderful opportunity to bond with your older one. It's natural for siblings to feel anxious about a new baby's arrival. So spend quality time with them, involve them in small tasks, and reassure them of your love. Helping them feel included now lays the foundation for a warm, lasting sibling bond. You may also want to consider joining antenatal classes during this trimester. These classes prepare you for labor and delivery, teach essential exercises, and provide expert answers to common pregnancy questions. Many mothers wonder about the best sleeping positions during this stage. It's safest to sleep on your left or right side, with the left side offering the best blood flow to your baby. That said, it's perfectly fine to switch between sides during the night. Just try to avoid lying flat on your back for long periods, as it can put pressure on major veins and restrict circulation. Overall, the second trimester is often the most comfortable and joyful phase of pregnancy. With fewer discomforts and plenty of energy, this is your time to truly enjoy the journey. Eat well, speak to your baby, read uplifting books, listen to soothing music, and allow yourself moments of pure connection and peace. Stay with us for the next video, where we'll cover the essential do's and don'ts of pregnancy and prepare you for the exciting third trimester ahead. Thank you for watching, and if you're ready to learn about what comes next, don't miss our upcoming third trimester guide